Prosper, feel free to start with your words. I think that we have
okay.
3 minutes into the webinar. Thank you.
Thank you all. I would like to thank you on behalf of the APF, African Pharmaceutical Forum, for giving us this opportunity, a real confidence to our forum to organize this webinar. I would like to thank Anyekan for his support, to thank all the speakers, and to thank, frankly, the moderator of this session, who is Arinola, Joda. It is a real opportunity for us to show what we can do, what we have as potentialities and competencies in our continent. So I would like to thank FIP Gonzalo for giving this opportunity to us. Thank you all. Have a good session. I hand over the floor to the moderator, Arinola Joda. Thank you.
Good morning, or good afternoon, or good evening, wherever you are in the world. We welcome you to this webinar. And we know that you're going to have a good time with us this morning, afternoon, or evening, as the case may be. The title of the webinar is The Pharmacist in the Prevention and Management of Vector-Borne Diseases, a Perspective from the African Region. I am Arinola Joda. I'm a fellow of the Pharmaceutical Society of Nigeria, as well as a fellow of the West African Postgraduate College of Pharmacists. I'm an associate professor and acting head of the Department of Clinical Pharmacy and Biopharmacy of the University of Lagos. Currently, I'm the Assistant Secretary / Editor-in-Chief of the African Pharmaceutical Forum, and I believe that you're going to have a very good time with us today. We welcome you, those that are here live today, and we indeed welcome those that will be listening or watching this webinar post later in the day or in the year. So FIP's vision is a world where everyone benefits from access to safe, effective, quality, and affordable medicines and health technologies. This webinar is being recorded and live streamed via YouTube, and the recording will be available on our website, events.fip.org. The mission of FIP is to support global health by enabling the advancement of pharmaceutical practice, sciences, and education. And on behalf of the African Pharmaceutical Forum, you already heard the president, Dr. Haig, welcome you. We are pleased to be delivering this event, Pharmacists in Prevention and Management of Vector-Borne Diseases, a Perspective from the African Region. This event is part of a series of events tracking the regional burden of vector-borne diseases and elucidating priority actions for each of the 6 WHO regions. In today's program, we will start with a brief introduction, and then our first speaker will talk on the most prevalent vector-borne diseases in the African region. And then our next speaker will talk on the roles of pharmacists in the prevention, control, management, and the treatment of vector-borne diseases in the African region. And then we'll have 3 very practical sessions of experiences by pharmacists from the region. Questions, of course, will be taken from the Q&A box or the chat box, preferably the Q&A box. But if you put it in the chat box, we will find it there. And then we'll wrap up and conclude. We welcome you sincerely to today's event. The learning objectives of the event are that we should recognize the main concepts related to vector-borne diseases, describe the characteristics and morbidity, mortality of the main vector-borne diseases in Africa. I'm sure if I do a poll right now, that what is the main vector-borne disease in Africa, everybody will get it right as malaria. Determine the activities that a pharmacist can develop within their pharmacy for the prevention, detection, control, and management of pharmacotherapy of vector-borne diseases. So in the next slide, we'll diseases account for more than 700,000 deaths annually, and they can be caused by either parasites, bacteria, or viruses. Malaria, well, as I said, the major vector-borne disease affecting us in Africa, is a parasitic infection that causes an estimated 219 million cases globally. For some of us that, especially here in Nigeria, where we believe that malaria is everybody's problem, we sometimes our minds get boggled at the numbers that malaria reports globally. Dengue is the most prevalent viral infection with an estimated 96 million symptomatic cases and an estimated 40,000 deaths every year. These resources were obtained from the WHO fact sheets. Other viral diseases transmitted by vectors include chikungunya fever, Zika virus, Ebola virus fever, West Nile fever, Japanese encephalitis, and all these are transmitted by mosquitoes. So you agree with me that once you kill a mosquito, you don't want to know whether it's female Anopheles, whether it's the Aedes, whether it's the Egypti, just kill mosquito. Ticks and encephalitis, which are transmitted by ticks. Other vector-borne diseases such as Chagas disease, transmitted by triatomine bugs, leishmaniasis, transmitted by sandflies, and schistosomiasis, transmitted by snails, affect hundreds of millions of people worldwide. Many vector-borne diseases are preventable through protective measures and community mobilization. Going on to the next slide, please. So this webinar series on vector-borne diseases is very timely. Vector-borne diseases account for nearly 1/5 of all infectious diseases and cause over 700,000 deaths every year around the world. Many of these diseases have been largely confined to specific regions, but this situation is now under profound change due to climatic change, increased global travel, migration and refugee movements, global trade, as well as other factors that are associated with the vectors themselves. Next slide, please. So many of these diseases are preventable through vector control and other measures, including effective vaccines and community education and engagement. In the practical session on experiences with our panelists, you will find some of these activities that they currently do, and you'll be encouraged to even initiate some of them in your own practice. Pharmacists are ideally placed to support communities and patients in protecting themselves against vector-borne diseases through awareness-raising campaigns and advice, education on vector control methods, disease prevention, vaccine administration and advocacy, treatment optimization, as well as other roles. So we're in a good place here today to learn what people are doing, what we can do, and what we need to do to improve the health of our community. So to address this problem, FIP is launching a series of events, or FIP has launched a series of events tackling the regional burden of diseases and priority actions in each of the 6 WHO regions. The Americas has held, the Africa is holding today, and we'll have for the Eastern Mediterranean, Western Pacific, Southeast Asia, and Europe on other days, according to the schedule set by FIP. Next slide, please. So we see that there's a link between vector-borne diseases and the FIP development goals. For those of us that have been in and around FIP for a while, we know that the thrust of FIP today is on the FIP development goals as well as the One Health program. And so it's good to know, to be able to link projects that are being planned or being carried out according to these FIP development goals. We see that there's a link. Even though communicable diseases is the goal number 16, there's a link between goals 7, 8, 10, 11, and 14 on, and even antimicrobial stewardship, that's 17, with the vector-borne diseases. Next slide, please. The next slide, we will see clearly how these links play out. So with our focus on communicable diseases, where vector-borne disease sits squarely, we can see the link to goal 7, advancing integrated services, goal 8, working with others, goal 10, equity and equality, goal 11, impact and outcomes, Goal 14, medicines expertise. Goal 17, antimicrobial stewardship, as well as goal 18, access to medicines, devices, and services. And as pharmacists, there's none of this that we cannot fit into to develop a program around managing vector-borne diseases in line with the FIP development goals. Next slide, please. So this table, which I'm sure you will look at very closely later, gives information about the various vector-borne diseases, where the regions where they are endemic, as well as the key preventive measures that are available for them. This table and the table on the next page, next slide please, give various vector-borne diseases, with malaria showing as all the various preventable measures can help malaria: vaccine, preventive medicines, insecticides, repellents, mosquito nets, protective clothing, and treatment. All of it work for malaria. Next slide, please. So in supporting pharmacists in managing vector-borne diseases, FIP has come up with a handbook on vector-borne diseases, a handbook for pharmacists. I implore you to go to the FIP website and download a copy of this site, and it's available in English, Spanish, French, and Portuguese for all the languages that we speak in Africa, or at least the major languages that we speak in Africa. Next slide, please. So for our first presentation, we have our guest speaker, Ms. Liliana Dayo. She is talking on the most prevalent vector-borne disease in Africa region. Ms. Liliana Dayo is the Malaria Program Officer and Senior
Dr. Arinola, I think you have internet connection problem. Can you hear us? We can't hear you. Dr. Arinola? I think we may have lost her, so I will just take over from here. My name is Anyekan. I'm part of the facilitator of this program. And once she comes back, then we can move back to her continuing moderating. Like she was saying, Mrs. Liliana Dayo is the Malaria Program Officer and Senior Advisor for Health System Strengthening in the County Program for Malaria in Kisumu, Kenya. She's an experienced program manager with a focus on malaria control, and she also serves as an advisor on the development of health policies and implementation, such as the Kenya Universal Health Roadmap 2018. So please, we welcome Mrs. Liliana Dayo to make her presentation.
All right, good morning and good afternoon, wherever we are all listening from. My name is Liliana Dayo. I will take us through some of the most prevalent vector-borne diseases in the African region. And before we proceed, I'll just take a bit of time to define what a vector-borne disease is. And this is a disease that occurs after an infection is transmitted to humans or other animals by agents such as mosquitoes, ticks, and fleas. And more often than not, these vectors are blood-sucking insects, which ingest parasites during a blood meal from an infected host. It could be an animal or a human being, and later transmit it to a new host after the pathogen has replicated within the vector. So some of the common vector-borne diseases in Africa include, I'll talk about the three, that is malaria, yellow fever, and dengue. And malaria is a protozoan disease which is transmitted from one person to the other through an infected female mosquito. It is estimated that in 2019, there were slightly above 250,000 cases of malaria compared to 228 million in 2018. The estimated number of malaria deaths is still high, and it's reported that in 2019, we had about 409,000 compared to 411 deaths in 2018. This is according to the World Malaria Report that was released in 2020. Yellow fever is a viral hemorrhagic disease which is transmitted by Aedes aegypti, and it's estimated that between 84 and 170,000 present as severe cases, while about 30 to 60,000 are reported to have died to yellow fever disease. Then we also have dengue, which is a viral hemorrhagic disease transmitted by female mosquito, mainly of Aedes aegypti species, and more than 50% of the population globally are at risk. It's reported that less of these cases rarely end up as case fatalities. This is due to some of the proper medical cares which are provided when the cases present in the various health facilities. So I will focus my presentation on malaria, which is the #1 cause of disease in Africa. I'll talk about its epidemiology, some of the interventions which as Africans we have put in place in line with the epidemiological map, and some of the updates on the prevention and control strategies. So epidemiology of malaria in Africa. Malaria is caused by Plasmodium parasite, and there are 5 parasite species that cause malaria in humans. We have Plasmodium falciparum, we have Plasmodium vivax, we also have Plasmodium ovale, Plasmodium malaria, and Plasmodium knowlesi. But of all these, the one that is of the greatest threat in Africa is Plasmodium falciparum and Plasmodium vivax. Malaria has a stable transmission throughout most tropics, with over 94% of the burden occurring in the African region. So this is just the epidemiological map of malaria in Africa, according to CDC 2020. And the blue shade indicates where malaria is not known to occur, and it's mostly around the poles. And then we have the yellow or orange that indicates malaria transmission occurs in some places, but we have the red color, which indicates that malaria occurs throughout the year. So in most African countries, we have strategies which have been adopted in the control and elimination of malaria. And I'll start by talking about the vector control. Some of the interventions implemented in vector control include the use of LLINs. LLINs is simply long-lasting insecticidal net. And we have one where the whole population is targeted. And here most countries do what is known as mass net distribution or mass LLIN distribution. We also have the routine LLIN distribution, which targets special groups, mostly pregnant women and children below the age of 1, who are said to be most at risk of malaria. We do also have indoor residual spraying using country-specific recommended chemicals. And we have larvicidin, which mostly targets irrigation areas where chemicals which are recommended by different countries are sprayed on the stagnant waters in targeting the malaria larvicides. And let's proceed. Targeting mostly the malaria larvicides which are found in the stagnant water. Apart from that, we have intermittent preventive therapy where we target pregnant women. Pregnant women are issued with sulfadoxine pyrimethamine at an interval of 4 weeks from 13 weeks or otherwise when they start feeling the fetal movement up to term. Most countries have targets, like where I am, we have a target of at least 3 doses of IPTP, but WHO recommends that every 4 weeks, the pregnant women should receive IPTP right from the time the pregnant woman is 13 weeks old. We have case management for malaria, where all those who are suspected to have signs and symptoms of malaria are tested either using microscopy or rapid diagnostic tests in areas where they cannot access microscopes. And all those who are found to have malaria parasites are treated using recommended drugs. Most countries so far are using artemisinin-based compounds. And Those who are found not to have the malaria parasites are actually advised to undergo further assessment to identify what other disease they could be suffering from other than malaria. In other countries, we do also have community case management for malaria, where volunteers from different communities are identified to test and treat household members who have got signs and symptoms of malaria. And mostly they use rapid diagnostic tests, and they are required to only test and treat those household members who have got signs and symptoms of uncomplicated malaria. Those who have got signs of severe malaria, ideally, these volunteers are supposed to refer them to the nearest health facility for emergency treatment or further assessment. And also the community volunteers are advised to follow up on the treatment of those who are being treated for malaria in order to ensure that compliance is adhered to and that the members of the household adopt preventive interventions to prevent them from getting malaria in future days. In other countries, we do also have seasonal malaria chemoprevention activities where appropriate medication is used to prevent members of the community from getting malaria. Some of them use Malaron, and some are reported to be using mefloquine to prevent them from getting malaria. Above all, we have increased activities on utilization of all malaria control interventions, where communities are engaged through social behavior change and communication activities, mostly with messages of helping them improve the uptake of malaria control interventions, such as ownership of bed nets and use, attending ANC at the right time in order to get IPTP for prevention of malaria in pregnancy, etc., etc. Now we have other additional interventions, such as malaria vaccines, and it's expected to be an important addition to the arsenal of tools in the future. Several vaccine candidates with different modes of action are currently in various stages of development to prevent them from getting Plasmodium falciparum and Plasmodium vivax infections. So at least one of these, which is the RTSS, is close to licensure and review for policy recommendation. So that's the end of my short presentation. I welcome the next presenter.
Thank you so very much, Miss Liliana Dio. Thank you for the insight you have given us into malaria from your position in the malaria program in Kenya. Our second speaker is Professor Azuka Opara, who is a professor of clinical pharmacy in the Faculty of Pharmacy, University of Benin, Edo State, Nigeria. He is an author and editor of Essentials of Pharmaceutical Care, an essential pharmaceutical care textbook for practicing pharmacists, student pharmacists across the region. Please join me in welcoming Professor Azuka Opara for his presentation on the roles of pharmacists in the prevention, control, management, and treatment of vector-borne diseases in the African region. You're welcome, sir. Professor Opara, do we have you?
I think Professor Azuka lost internet connection.
I think we might have to move on to the next speaker while we are waiting for Professor Azuka to come back online. So while we await Professor Azuka, I would like to welcome the next speaker who will be talking about managing vector-borne diseases in Ghana. His name is Pharmacist James Frimpong. Pharmacist James is the Deputy Program Manager at the National Malaria Control Program in Accra, Ghana. He has significant experience in pharmaceutical regulation, private sector healthcare delivery, and public health management. He has led a team of professionals from the National Malaria Control Program to produce the 2007 Ghana Needs Assessment Malaria Operational Plans for PMI and Ghana, and other key National Malaria Control Policy document. Please, let's welcome Pharmacist James Frimpong for his presentation.
Thank you, and good morning or good afternoon to you, wherever you may be. As indicated, my name is James Frimpong, Deputy Program Manager of National Malaria Control Program. I'm going to share with you experiences of the pharmacists in Ghana in the fight against malaria. As a key stakeholder, a key player in the health sector, the pharmacist has and continues to contribute to the development of policies, guidelines, and training materials to fight malaria. Pharmacists have been a key stakeholder in the revision of the malaria treatment policy, from using chloroquine to treat uncomplicated malaria to the use of artemisinin-based combination therapies. And pharmacists played a key role in that change management. In the beginning of the transition to ACT therapies, the local pharmaceutical manufacturers were engaged extensively to ensure that there will be continuous availability of the ACTs, which was then a novel product with limited supplies. And in the same vein, pharmacists have contributed to the training of other cadres of service providers when the treatment policy was changed from chloroquine to ACTs. And pharmacists also play a key role in the diagnostic services of malaria by using rapid diagnostic tests in their community pharmacies through a special arrangement that they had to make with the malaria control program. Next slide, please. Next slide, please. So whilst they use the rapid diagnostic test kits, they also offer treatment for the cases that were found to be positive. And the treatment was crystallized by the implementation of the affordable medicine facility for malaria, which was supported by the Global Fund. In fact, this was a private sector co-pay mechanism to make sure that quality and affordable ACTs would be available and affordable throughout the country. It involved the management of the engagement of stakeholders, including pharmacists, the wholesalers and retailers, operating under an agreed memorandum of understanding. In fact, the entire affordable medicine facility for malaria was managed hand in hand with the pharmacists, and the local pharmaceutical manufacturers who were not WHO pre-qualified and therefore could not be a source of supply, but by the Global Fund and the World Bank and the USAID, they had to step into manufacture and supply according to stringent manufacturing practices ensured by the FDA of Ghana. And they also encourage the order and distribution of ACTs that were WHO pre-qualified. Next slide, please. This AMFM was implemented with the full support of the Pharmaceutical Society of Ghana and pharmacists in general, playing a central role to ensure that people complied with the price reduction that was stated in the agreement. And the project was actually monitored for compliance by the Pharmacy Council of Ghana and contributed greatly to the fight against malaria in Ghana. In fact, the pharmacist has been playing and continue to play a key role in the supply chain management of anti-malarials, from production, storage, distribution, and ensuring rational use to pharmacovigilance of same. Next slide, please. Next slide. Community pharmacies I think there's a missing part.
Yeah, I think there were 3 slides, so it's completed.
Okay. So in a nutshell, the pharmacist continues to play a major role in the fight against malaria through services that they offer at their community pharmacies and also at every level and in every community in Ghana where pharmacists are, they play a major role in it through the distribution of insecticide nets at their community pharmacies to eligible and beneficiaries. So in a nutshell, this is the contribution of the pharmacists in the fight against malaria in Ghana. Thank you. So thank you for your attention. And
thank you very much, Pharmacist James. Okay, thank you very much, Pharmacist James Frimpong, for your for the experiences that you have just shared with us. We're grateful. Going on, we'll be inviting you, Victory Drugs Limited, a community pharmacy located in Festac, Lagos, Nigeria. She's an associate member of the Royal Pharmaceutical Society. She's passionate about the Return Unwanted Medicines project and at the forefront of promoting RUM to healthcare professionals and the public. She's a trainer of trainers of life skills and family wellness programs. Please join me to welcome pharmacist Folashade Lawal to share her experiences in managing vector-borne diseases in Nigeria. You're welcome, ma'am.
Thank you for having me. Good morning, good afternoon, and good evening, depending on where you are. Nigeria contributed 27% to global malaria cases and 23% to total deaths in 2019, and that makes malaria very important to us. So I'm going to be talking about our roles in the community as community pharmacists in prevention of vector-borne diseases, with particular focus on malaria, more because we know that the vector mosquito is a vector to so many other diseases, and like we have been told earlier on, once we deal with mosquito, we might be dealing with so many other diseases as well. Next slide. So we'll be looking at vector control, personal protection, right diagnosis, prompt and right treatment. Next slide. We've done quite a lot of work in public enlightenment because that is the bane of the prevention. As long as we're able to get the public to understand why they should protect themselves from the vector, then we would have gone a long way to prevent the infection. So we did a lot of public enlightenment, and what I'm going to run us through some of what we did. We targeted communities, schools, faith-based organizations, workplaces, and currently we have online groups to reach out to. We also have several activities that we run to promote public enlightenment, such as we give lectures, we do life skills for positive behavioral changes, we organize debates, quiz, outreaches, we do artwork competitions, and we are also involved in researches. Next slide. So this is one of the comical ways we used to teach test before you treat. So we had this like a form of story, guilty or not guilty, between the judge and the plaintiff. And at the end of the day, the next slide. Next slide, please. Yeah, let's go to the next. Next slide. Yeah. At the end of it all, the judge concluded that we cannot blame everything on malaria. It must be a test to confirm before we throw blames at malaria. And that is just a comical way of talking to people about testing before they treat, which is in line with the WHO recommendation. Next slide. We also had this poetry, and it talks about malaria vector, and it came in a very hilarious way to describe mosquito, the exterminator. We did this in 2015 to mark World Malaria Day. This involved all community pharmacists because it was organized at the Drug Information Center when I was chairing that unit. So this also is one of our ways of intervening in malaria prevention. Going through this, you would get a lot of information about what you need to do to protect yourself. Next slide. We also have life skills periodically for students. This is one of the programs we organized to mark Children's Day, where we taught them about goal setting. So they set goals for life, and one of the hindrances to realizing their goals is if they have ill health. One of the causes of ill health common among us is malaria. So we related that to preventing malaria and then looking at the main enemy, which is the mosquito. Next slide. We also organized quizzes, and this is one of the quizzes we organized using story to teach prevention and treatment. So we had this titled Beauty and the Vampire. So children were encouraged, it was for ages 7 to 12, and then the children were encouraged to come in, read and answer questions at the end of it, submit their answers, and then we had a party for them at the end of the program to honor those who did very well in it. Next slide. Next slide. So this is the end of that quiz competition. And then we also have our input in rapid diagnostic test malaria. We did a little, we looked at our experience over a period of some months to say how many people actually agreed to do tests before treatment, how many of them tested positive. This is to enable us pay more attention to rapid diagnosis tests of malaria and encourage testing before treatment. Next slide. Yeah, we also came up with an algorithm for managing malaria in the community pharmacy, because we know that in our climate, most people just walk in, they want to buy malaria drugs. And everything is blamed on malaria, whatever symptoms they have. We know that so many things mimic malaria, or malaria to mimic so many things in terms of symptoms. So we came up with this algorithm, and for every stage, we are teaching prevention, not just treatment. Once the patient comes in, we have the opportunity to talk about malaria prevention. We look out for danger signs and refer appropriately. And then those who don't have the danger signs, we go on to do RDC. At the end of the RDC, whatever the result comes out, we determine the next stage, but we try to encourage everybody to learn malaria prevention. Next slide. So I'll conclude by saying that pharmacists as frontline healthcare professionals, we are strategically positioned to contribute immensely to the prevention of vector-borne diseases and prompt access to treatment. Thank you. Next slide. Thank you.
Thank you so very much, Lawal, for your very practical session on what you have been doing in managing, preventing malaria, a serious vector-borne disease in Nigeria. Next, we'll be inviting Professor Giselle Etame. She's an associate professor and head Department of Pharmaceutical Sciences, Faculty of Medicine and Pharmaceutical Sciences, University of Douala, Cameroon. She's an expert trainer, DAD and KIMS in quality assurance and pedagogy in higher education. She's also MD CEO, Pharmacy Ambre in Edia in Cameroon. She's an expert counselor of women wellness associations. Please join me as she shares her experiences in managing vector-borne diseases in Cameroon. You're welcome, ma'am.
Thank you for introducing me. I would like first to thank the FIP for the organization of this webinar on this important topic for the health of emerging country population. I think that the pharmacist is a frontline health actor as the most accessible healthcare professional. He develops relationships of trust with patients. And as pharmacists, I think we have a unique role in healthcare and in the community. In this role, I think I have a 3-in-1 role. I will mainly speak about my role as a community pharmacist, as all the previous speakers have spoken about the role of explaining the vector-borne disease pathology. As a community pharmacist, I think that my role is based on information and advice. I inform my patient on the prevention of vector-borne diseases, in particular malaria or filariasis, mainly. Prevention by chemoprophylaxis and hygiene sanitation measures. For example, on the proper use of repellents, on the protective clothing, like including long sleeve shirts and trousers, long socks, etc. I give also advices on the treatment of vector-borne diseases for the proper use of the drugs, in particular to avoid resistance, and information on side effects and warning drugs. I think in this case, it is a role of pharmacists, like private pharmacists. It's my role like as a private pharmacist. And as a community pharmacist and local health stakeholder, I usually take part in awareness raising campaign. I participate in organized campaign of environmental sanitation to eliminate the outbreaks of parasites like stagnant water, household waste, wet areas in the neighborhoods. I also organize campaigns for the wide use of long-lasting insecticidal nets, the wide use of indoor insecticides, and participate also in the campaign for information education on larval cells management. I'm involved in the campaign for chemoprophylaxis of pregnant women and newborn. My role as associate professor. I think that research in Africa must focus on development because it's a necessity to contribute to the emergence of countries. Moving from basic research to everyday applicability to advanced development must be a goal for us pharmacists, especially in research. My main area of research is medicinal plants to find plants and molecules of interest, including against vector-borne diseases. Like I actually work on biopesticides, for example. I have recently co-organized last April a symposium on the challenge of fighting malaria vectors in low-income countries. The debate was on economic challenges and preventive measures in malaria control, on the vector control method in Cameroonian cities, and on the mosquito ecology in malaria transmission. I will not go into the details because we had some good presentation from the previous speakers. So I thank you for, this was my short contribution to this webinar. Thank you.
Thank you very much. Before we go to questions and answers, we'll just quickly go back now to take Professor Okpara's presentation. Professor Okpara had some challenges joining us with his internet, but he's here now. So we'll just quickly go back and take his presentation on the roles of pharmacists in the prevention, control, management, and treatment of vector-borne diseases in the African region. Professor Okpara, you are very welcome.
Thank you so much, Joda. Let me apologize for the technical glitches that I experienced. I appreciate the invitation to participate in this program. Briefly, we'll be looking at this topic from the following outline as shown. So we take a brief introduction and then go on to the specific roles of pharmacists. We move on, please. Now, vectors have been discussed earlier on, but it would be good for us to know that vectors transmit diseases without being affected by the diseases that they transmit. And some of them are mechanical, just like transporters. And others are biological vectors because part of the life cycle of the parasite takes place in them. Of these vectors, we should be very, very concerned about insects because 1 person in every 6 persons is infected by insect-borne disease. They belong to the arthropod group, which is known to be the largest division in the animal kingdom. And very many of them, at least a million known species do exist. Next slide. Well, the types of vectors have been elaborated. Human vector, human transmission, the anthropootic infections, and then the animal vector human transmissions, the one we know as zoonotic infections. Next slide. Now, there are some specific roles of pharmacists. Pharmacists have a role to play to contribute towards reducing the high burden of vector-borne diseases, because 17% of infectious diseases and about 700,000 deaths are known to occur annually worldwide. And of course, majority of the cases occur in 4 African regions. Now, pharmacists have a unique position to contribute to this by virtue of their training, which now has a public health focus, their accessibility, proximity to patients and communities, and of course, their expertise in the medicine area. Now, these are some of the specific rules. Education, or educating on prevention methods. Many vector-borne diseases are preventable, and that is the good news, either through vector control or through protection from vectors. Of course, this actually depends on the type of the vector. For instance, for the mosquitoes, that has been well elaborated, use of insecticide sprays, insecticide-treated mosquito nets, fly-proof windows, proper skin coverage, proper use of repellents. Of course, pharmacists really must counsel on the proper use of these repellents. And then, of course, prevention of the mosquito breeding sites. Now, for the Zika virus and Onchocerca volvulus, These ones may be transmitted through sexual intercourse, and most people do not know this. So pharmacists have a role to play, by way of educating people on this mode of transmission, because there is a knowledge gap. So they encourage safer sexual practices by way of advocacy. And then, of course, good hygiene practices, which will generally prevent several vector-borne diseases. Now, counseling on use of repellents. Community pharmacy should counsel clients obtain these insect repellents on the correct usage for safety and effectiveness. And this includes that repellents actually ward off insects by virtue of their smell, and they do not kill them. And that, should be well drummed into their ears. And the duration of action depends on the concentration. For instance, 10% diethyl tulamine protects for approximately 2 to 3 hours, whereas if it is 25%, it offers an average protection of about 6 hours. Now, citronella is less effective than this, and in situations of severe attacks, so it is not recommended. But it is a choice for children who are below 2 years, and of course in pregnant women, because of the low toxicity. And we should also advise clients purchasing these items to read the label instructions and follow the instructions. Pharmacists also have a role in compounding the mosquito repellents, where you do not have industrially manufactured ones. Of course, pharmacists are taught the art of compounding, so they use standard formula and standard compounding, good compounding practices to make these products available to their consumers in the communities where they work. Next slide. Pharmacists also have a role in improving vaccination coverage, because we know that some of these vector-borne diseases are vaccine preventable. Examples include dengue fever, yellow fever, tick-borne encephalitis, and Japanese encephalitis. So pharmacists can contribute by improving the coverage of vaccine use through raising awareness about these vaccines, screening and identifying those requiring vaccination, addressing concerns through evidence-based advice, advocating for vaccination in their communities, or hosting immunizers in the community, or where legally permitted, serving as immunizers. Also, we as pharmacists have a role to optimize adherence to treatment and also adherence to prophylaxis, where that is obtainable. We know that adherence is an intermediate clinical outcome in therapy, and it is a patient behavior which is difficult to manage due to multiple factors, which include health literacy, cost, transportation, and other limitations which affect patients' understanding of the medicine and their access to the medicine. So, pharmacists have a professional responsibility to work with patients in implementing patient-specific strategies to improve adherence. And for where cases that chemoprophylaxis is possible for those at risk populations, such as anti-malaria prophylaxis for travelers, that has been talked about, use of atovaquone, proguanil, doxycycline, mefloquine, and so on. And of course, use of praziquantel for schistosomiasis, use of albendazole, ivermectin, or diethyl carbamazine for lymphatic filariasis, or use of ivermectin for onchocerciasis. Pharmacists also have a role to play in reducing social stigma associated with some of these vector-borne diseases, because many of them pose the risk of becoming chronic and debilitating, which can lead to long-term disability. For instance, lymphatic filariasis and leishmaniasis leave behind disfigured limbs and scars. And of course, these tend to be more associated with social stigma. So what can pharmacists do? They can reduce social stigmatization by offering their help and services to all patients without discrimination. Also, by providing empathy to those facing stigmatization. And pharmacists should become patient advocates on campaigns against discrimination in their communities. Pharmacists have a role in emergency preparedness because periods of increased transmission correspond to surges in vector population. So as a result of changes in climate, migration, urbanization, and internal displacement, because of crisis in many African countries, you have crisis and people are being internally displaced. And we know that since 2014, major outbreaks of dengue, malaria, chikungunya, yellow fever, and Zika virus infection have afflicted populations. And of course, this can overwhelm several healthcare systems. So pharmacists in the community are in position to pre-position against outbreaks. That is making some kind of advanced preparation, maybe by way of stocking relevant materials, also by providing health information to the community. So by way of conclusion in this short presentation, we say that pharmacists have a crucial role to play to reduce the burden of vector-borne disease in the African region in the following ways: educating on prevention methods, counseling on use of repellents, compounding mosquito repellents, improving vaccination coverage, optimizing adherence to treatment and prophylactic use of agents, reducing stigmatization among those suffering disability, and emergency preparedness. And you can get more information on these rules by looking at the FIP document on vector-borne disease, the handbook for pharmacists. Thank you for listening.
Thank you very much, Professor Opara, for your very as well as various populations that we attend to. So we're very grateful for that presentation, sir. I don't seem to have seen any questions on the chat box. I don't know if, I think we still have a little time. So maybe we can have some hands up if people want to make some comments, they want to ask questions directly. We have a few minutes to accommodate some questions or some discussions around what we have heard now. So if you would like to indicate, I'm not sure how that would work right now since I can't see anybody. So is there anybody that would like to ask a question or make a comment around what we have heard? We started with Ms. Liliana Dayo's presentation, where she looked briefly at different types of vector-borne diseases in Africa. And then she zeroed in on malaria, which is our main problem in many parts of Africa. And she looked at some of the roles that we can play. And then Professor Azuka Opara went to town on the different roles, including emergency preparedness. We know that many parts of Africa is endemic for malaria, but we have had outbreaks of Zika, of Lassa fever, of Ebola virus. And currently right now, the whole world is grasping with COVID-19. So these outbreaks indicates a need for pharmacists to be prepared and to be ready to take on that role in mitigating the circumstances that our patients or clients may be exposed to. In the various presentations by our panelists on their experiences, we had Phan Frimpong talking about the work of the National Malaria Control Program in Ghana and how they have empowered pharmacists and even clients in managing malaria, especially with the affordable medicines facility that is geared towards providing quality assured, available and affordable artemisinin combination therapies for the region. We also have a national malaria program in Nigeria, and they're also working assiduously to ensure that these products are available. I want to share a quick experience. When the AMFM program started in Nigeria, and these products were available in the pharmacies, they were so cheap. Patients rejected the drugs because they were so cheap. It was such a bad thing that when you tell patients that this artemisinin lumefantrine combination is costing, I think at that time it was costing, I think 50 naira or something, or 150, I can't remember. It was such a ridiculously cheap amount compared to what they were already buying with the Lonart, with the Amatems. You know, so they were like, this cheap malaria drug, it must be fake. So they didn't buy it. And so the pharmacists themselves decided that, okay, if it is the cheap cost that is letting you not to buy, then they added cost to it to make it more acceptable to people. Can you just imagine? Something that is supposed to help us became a problem to us. You know, and I'm not sure if there was such a similar incident in Ghana or in Nigeria. It was a big problem. People rejected the affordable drugs because they were too cheap. I can't get over it. You know, so, and then pharmacist Lawal gave us some very interesting activities that she has been engaging in her pharmacy, including poem competitions, quiz competitions, debates, research activities, to raise awareness of clients about preventing malaria, about the new paradigm of testing before you treat. And these are very exciting things to find that people are doing currently and other people can begin to do. Professor Etame talked about her roles as a community pharmacist, as well as her roles as an associate professor researching into plants and materials that can be used in the management of malaria and other vector-borne diseases like filariasis. You know. So that I believe I've done a quick overview of what we have heard so far. And while I'm trying to see if any questions will come up, and it does not seem that there are any questions still. You know, so I think we will just go on.
There are questions. There are questions
okay.
on the chat box.
The chat box now. Okay.
Yes.
Yes. Fine.
And I think I have two questions there.
Please go ahead, sir. Go ahead.
Yes. Somebody is asking the formula for compounding the insect repellent. Now, let me just refer you to the handbook, the 5P handbook. Okay, the formula for different repellents are indicated there. So that if you see the ones that you have the local materials, you can lay your hands on them. So also in terms of quality control in the compounding methods, they're all well listed in that handbook. There's also another question that is talking about duration of action of these agents that we use as insecticides. Yes, they all don't have the same duration of action. And why is it important? For instance, we talked about DEET. At the percentage, 10% or 25%, the higher at the concentration, the longer the duration of action. Now, supposing you want to make an indoor spray, you want to spray indoors, and maybe if you do it about 6 p.m. for an agent that the duration of action is 3 hours, that gives you an idea of when the effect will wear off. And it is important for us as pharmacists, so that you can estimate when the effect will wear off. One, that helps you in knowing the action on the vectors. That also helps you in knowing the safety on the human beings who will be staying in those rooms. Because there is also residual effect, so you must make sure that the residual concentration of these agents is so minimal that they will not be toxic, to the human beings who will be staying in those environments. Thank you.
Thank you very much. So there's a question says, which rapid tests are being used in pharmacies? Pharmacist Lawal, do you want to take that question? Also, I will direct another question to you that says that I did not understand, Pharmacist Folashade, how you use poetry and quizzes as a method of passing information. So if you can just take those two questions.
Okay, thank you for asking me. We have some approved rapid diagnosis tests. The one we use mostly is the SZ rapid test. And then there's also a device called Reader. It's shaped like a POS machine, except that it's a bit bigger. It reads, it's developed by InterSwitch. It reads the rapid diagnostic test kit itself. So when you insert it in, even when the malaria line, the positive line is too faint for the naked eyes to read, it reads it. So that gives us some more degree of accuracy in interpreting if the patient has malaria or not from rapid tests. So that is what we do. Now about using poetry, drama, quizzes to teach. It's very effective, especially in young minds, young people. They act it out. That makes it stick more. We know that's when you give a lecture, it's not the same thing as when you do a story or you make them to write a competition in poems. They go into a little research within themselves. They dig into the information. They come up with very creative ideas. It's very engaging, and we do that a lot. For the juniors, primary schools, we engage them in artwork, drawing things around malaria. It makes it stick. So that is what we call experiential learning. And it's very good, especially as influencing positive behavioral changes, rather than just teaching, instructing. It's more involving and participatory. I don't want to do a whole lecture on that to save our time. Thank you.
Thank you very much. Thank you very much, Pharmacist Lawal. There's a question here that I'm not really sure I understand, but it's around, it says that, does the team take into consideration the role of pharmacists in curbing, believe that should be curbing substandard vector control drugs? And then that question was by Mohammed Suleiman. Professor Cyril Usifo is also asking, how do fake and substandard drugs affect treatment outcomes of malaria vis-a-vis the role of the pharmacist? And I'm going to direct those questions to you, Pharmacist James Frimpong, please. They're talking about the role of the pharmacist in curbing substandard vector control drugs, as well as how do fake and substandard drugs affect treatment outcomes of malaria vis-a-vis the role of the pharmacist. Thank you.
Thank you very much to the questioner. I suppose the person who asked the question wants to know how the substandard medicines affect the control of malaria, or for that matter, any vector-borne disease. Being a pharmacist at whatever level you find yourself, or whichever sector you find yourself in practice, it is your professional duty to ascertain whether the product you are offering for sale or for treatment meets the standards the quality standards prescribed in the normal practice. So the pharmacist serves as a gatekeeper to ensure that such substandard products don't get through to the consumer. That is one. The other point is also that normally the FDAs are the gatekeepers for the country in general to ensure that substandard products do not enter the country. And if they do, then they rely on the pharmacists to raise the red alert to ensure that the products are recalled. And pharmacists will have to contribute to the recalling of medicines that have been found to be substandard. And if they we pharmacists play our role very well, and we will block any product that has been found to be substandard so that it doesn't get to any distribution outlet at all, let alone getting to the consumer. The effect of substandard medicines on malaria, I can talk of chloroquine in Ghana. In the time that we used chloroquine to treat uncomplicated malaria, there were several products found on the market through other medicine outlets like the licensed chemical sellers, which was mainly operated by people who were not trained pharmacists and therefore had no experience in detecting substandard products. And these things led to the failure of chloroquine in treating uncomplicated malaria. That accounted for the change in policy from the use of chloroquine to treat uncomplicated malaria to the artemisinin-based combination therapy. And what we have to bear in mind is that people who do some substandard products are in their business. So it is the role or the duty of the pharmacist to keep an eagle eye on the products so that they don't get into the country at all. And if they do, pharmacists will have to prevent its distribution. And another thing that the country is doing is to conduct intermittently therapeutic efficacy studies. In fact, on the ACTs, it is done every other year with the Noguchi Memorial Institute for Medical Research. And this serves as a way to get alert and early warning when the products start failing. So substandard products, they can affect the management of any vector-borne disease, and for that matter, any medicine at all. And therefore, we pharmacists must play a role in keeping the products out of circulation. So I think that is what I can say about that. Thank you.
Thank you very much. Do any of our panelists have anything to add? And while you're thinking about that, there's a rider to Professor Sipo's question, which says that, are there any known food and anti-malarial drug interaction that can be shared here? So if anybody has anything to add to that or to share on that, any food drug interaction with anti-malarials, as well as if there's anybody that has any other comments on the impact of fake and substandard drugs on the outcomes of malaria therapy. You're welcome to please provide that information now. Thank you. Okay, while we're thinking about that, Professor Azuka, there's a question for you on the chat box, which says that how do pharmacists improve vaccine coverage, and which vaccines specifically? The question is from James Oleket from Kenya.
Yeah, thank you, James. All vaccines, pharmacists have a role in improving the access to their utilization. And the primary role of pharmacists is by way of advocacy. You see, like in these days of vaccine hesitancy, pharmacists have a great role in educating the public that actually these vaccines are first-line interventions in healthcare. And before any vaccine is registered for use, it must have improving in terms of the safety and efficacy, through well-known controlled clinical trials, so that the hesitancy must be discouraged. Then also, some of these vaccine products, of course, they require proper storage conditions. And well, pharmacists being custodians of medicines, you should ensure that the vaccines are properly stored. Because if the vaccines are not stored at the right temperature, even when you administer them, believing that you have vaccinated, you will not achieve immunization of these patients. Because we as pharmacists must know, or even tell people, that introducing the vaccine into the body is simply a process that should lead to the immunization. And if these vaccines are not properly stored, yes, you might have carried out the process of vaccination, but the other end point, the outcome of immunization, will not be achieved. So I think pharmacists really need to be very assertive about educating not only the public, but also other healthcare providers on these areas. Thank you.
Thank you very much. There's a comment here on, I think, Professor Itami. Did we just lose her? Okay, Professor Itami, I will send this question your way. Eric Asari is asking, please, what exactly does mosquito feed on?
Thank you for the question. Mosquitoes feed with blood. Mainly blood.
Yeah.
I wanted to answer about the question between question on the interaction between food and anti-malaria.
Okay, thank you.
I wanted to precise that there are non-interaction between drugs and some food like grapefruit.
Yeah.
Grapefruit, I think it is pomelo. There are some non-interaction between some foods like pomelo, grapefruit, and drugs in generally. So there is some interaction between food and anti-malaria.
Thank you. Thank you very much. In addition to that, we know that a fatty meal, taking artemether-lumefantrine with a fatty meal, increases the bioavailability of the artemisinin products.
Yes,
so you may want to be careful if so as not to tip into an overdose condition, depending on what other effects that the person may have. So there are some. It is usually advocated that a fatty meal be taken along with the artemether-lumefantrine products to increase the bioavailability.
And
artemisinin, those are the common ones.
And
yes,
artemisinin tisane also. When we take artemisinin plant like tisane or in hot water, don't have to take it nearly the fatting meal or nearly alimentation.
I didn't get you, ma. I didn't get you. You were not clear.
I was saying that it is okay. I was saying that even with artemisia, when you drink artemisia in the hot water, you need to drink it near the fatty meal also. Have to drink it.
Thank you very much. Okay. I think in closing, I don't think there's another question. I just want to read out a chart by Mayanga. I can't see his full name right now. He says that pharmacists are and should be involved in the formulation of policy on those vector-borne diseases. I have been involved in formulation of policy on malaria and policy and operations guidelines on integrated vector management. And I read it out to also point us to the fact that we're not just healthcare providers to provide just the hands-on service at the community pharmacy or hospital pharmacy at the practitioner level. We also have a critical role to play in policy, and that is the macro level of public health, where a lot of us as pharmacists, we are not found. So if the opportunity presents itself to you to be involved in policy making, in guidelines, in setting the rules of engagement around healthcare systems, please be prepared to take up that opportunity. Don't pass it on to somebody else. I know some of us as pharmacists, we like to say, no, I don't want them to know that, I don't want them to see my face, but it's not helping us in the long run. So present yourself as a capable, informed professional, and provide those services that can help to ensure that appropriate policies are in place. For instance, right now, I'm sure in almost all countries across Africa, we need policy change in terms of vaccine management in our countries. And it is the pharmacists that are within those systems that will help to ensure that those voices are heard and those changes are effected. So I just wanted to bring that up. If you find yourself in a position to contribute to such policies, don't shy away from that opportunity. If you are not sure you know what to do, first of all, accept the position. Then go and look for those that can help you prepare your position paper, prepare your guidelines, whatever. But accept the position first. Don't say you are not able. You are able because you have a wealth of people around you that can assist you in achieving the goal that we all need as pharmacists across the region. Thank you very much. So if there are no other questions, no other comments, I think there have been a few additional questions. We'll soon be running out of time, but let me see if there are one or two that we can take. It says, which antimalarials do you use in Nigeria if the patient is pregnant? Also, if they are not, what's the most common drug used? I think I'll just answer that. How many pharmacists have had the opportunity of handling the logistics, storage, and administration of the COVID-19 vaccines? I'm not sure that's before us today. Why is the female Anopheles mosquito responsible for the transmission of disease? Dr. Machi Hampango says that even our research should be targeted at informing policy. The current situation in Nigeria leaves the immunization program in the hands of community health workers, who you can't hold on to. You can't hold on to the safety and storage of these vaccines. Yeah, as I said, we need some policy changes in terms of vaccine administration generally across most of Africa. And the COVID-19, handling the COVID-19 vaccine is certainly within the purview of that. I smiled at the question, why is the female Anopheles mosquito responsible for transmission of disease? We really don't know why, but that is what has been found out by research, that it is the female Anopheles mosquito that is responsible. Unfortunately, you can't identify which is the female Anopheles mosquito when a mosquito is biting you. So the important thing is just to prevent being bitten by any mosquito. Pharmacists, okay, there was a question I wanted to answer earlier. So which antimalarials do we use in Nigeria? When patients are pregnant, they are put on IPT, preventive prophylactic therapy with sulfadoxine pyrimethamine. And I believe that if still in the first trimester, I'm not sure, don't let me say what I'm not sure of. I know of the prophylaxis against malaria with SP. And then for treatment, I think they still use the ACTs actually, except maybe in the third trimester. The commonly available antimalarials right now are the artemisinin combination therapies. As Frimpong said, the treatment policy for malaria changed in Nigeria as well when chloroquine began to fail, and a nationwide study was done where efficacy against malaria for chloroquine dropped to less than 30%. And so ACTs are now the treatment of choice for malaria across the country. And we have different brands of ACTs around in the country, artemisinin, lumefantrine. We have the artemisinin, amodiaquine, the AA. We have various other combinations that are available. And I can say that with the AS monotherapies have been largely pushed out of the market, so we don't have the chloroquines or the SPs being used, or even the artemisinin monotherapy being used in malaria treatments to any extent anymore. Most therapy for malaria is now with the artemisinin combination therapy. So I think we're going to rest it there. So I want to thank all our panelists and our speakers. We've had, I believe that we've had a very interesting time here today. I don't know if we can, I think we can, not sure, can we accommodate each of our speakers to just give a closing statement, one statement, not an inaugural lecture, please. And I'll start with Ms. Liana Dio.
Right, thank you so much, Professor. It was really, really pleasant to be here.
Ms. Dio, please go ahead with your closing statements.
All right, thank you so much. Can you hear me? Thank you very much. It was a great pleasure to be here with you all today. Let's continue the fight against malaria. Let's draw the line against malaria. And always remember that zero malaria begins with you and I. Thank you so much, and God bless you all.
Thank you very much. Professor Okpara, please.
Yeah, I think pharmacists' number one role is that of advocacy, educating the public. And the only way they can be effective in doing this is by starting to educate themselves. So let us try and get as much information as possible on these common vector-borne diseases in our communities, so we can pass the correct information to the populations around us. Thank you.
Thank you very much. From James Freeprong.
Yeah, thank you very much, co-panelists, and thank you very much, organizers, for giving me the opportunity to share experiences in malaria control in Ghana with you. I hope that we will continue to play that role, and I encourage colleague pharmacists to take up the challenge. Somebody talked about policies, guidelines, and all. So pharmacists are capable. We have done it in Ghana, and I think it can be done everywhere in Africa. Thank you, and thank you for allowing me to share experience with you. Thank you.
Thank you very much. Pharmacist Lawal.
Thank you once more. I will just want to say that, like Edward Bonke says, nobody made a greater mistake than he who did nothing because he could do so little. So we all have to put our hands on deck and work together to overcome vector-borne diseases and other challenges that we have in Africa. Thank you.
Thank you very much. Professor Etame.
I thank also for organizing this webinar. Despite my poor connection, it is a very, very good initiative, as this topic is a big problem for the health of those of emerging countries population. Thank you very much. I expect that you will renew this occasion. Thanks. Thanks to all.
Thank you. Thank you very much, everybody. Okay, ma. Thank you so very much, everybody, all our panelists and speakers. With all this information that we have shared and we have learned today, it's time to wrap up today's episode. I sincerely thank Anyekan for filling in the blanks when my internet was messing up. I thank Dr. Ohia for giving me the opportunity to moderate this event. And I thank FIP for deeming APF worthy to organize this event. Thank you very much, everybody. And we'll see you at the next FIP Digital